Okay, today we're going to be going through a couple techniques with a PNF technique. We're going to go through diagonals 1 and 2 with hip extension and flexion. Um, so the first thing we're going to do is we'll do D1 starting in extension and going into flexion. So we'll run the patient through the motion first, and then we'll go and do the actual technique. So we'll start the patient here in hip extension, abduction, and internal rotation, and then the foot is in plantar flexion, toes are in flexion, and the foot is in eversion. So as we run through the patient through it, the foot is going to dorsiflex, toes are going to extend, and the ankle's going to invert as the hip is coming into flexion, adduction, and external rotation. Alright, so we'll just running that just to so the patient is familiar with the movement here and up here. Okay, so now we're gonna ask the patient to do the motions that as I put some hand placements in the particular places, and the patient will move through that motion. So we'll start the patient down in extension. So we'll go toes up, foot in, and then flex on the hip, externally rotate, and adduction. Okay, so we'll go through again, hand placement, and hip up, good, and then we're turning like that, good, like that. Okay, one more time there. So toes up, foot in, hip up, and hip out, like that. Okay, so that's one. Now we're going to take and just go in that opposite direction. So now the patient is in hip flexion, external rotation, adduction, and the foot is going to be dorsiflexed, inverted, and toes in extension. So now my hand placement is going to be more on the opposite side. That way it can facilitate his movement. So patient's now going to push down, toes down, foot out, and then leg down. So you're going to go hip down into flexion, internal rotation, and abduction. Okay, so we'll do that again. Just down, good. All the way down, good. One more time. So we'll start him here. So toes down, good, down, and pushing the opposite way. And last time. So foot down, toes down, and hip down, flexion into extension. Okay, and pause it there. So now we'll begin the D2 diagonal in starting in extension, going into flexion, and then we'll do it the opposite way. So patient right now is starting with a hip in extension, hip in adduction, and external rotation. And then at the ankle, you have plantar flexion, toes flexion, and inversion. So first we'll get through the motion for the patient. So we'll just do it passively. Go up, like that, and down here, and then here. So the patient will be going. The patient will start with the toe extension, dorsiflexion, eversion, hip flexion, internal rotation, and abduction. Okay, So now we'll do the hand placement. So we'll start at the toes. So toes up, foot out, knee up, and start pushing, internal rotation there. Okay, I'm going to do it again. Toes up, foot out, leg up right here, knee, and we're pushing out here. That way there's the internal rotation at the end. One more time. Toes up, foot out, knee up, leg out, and foot out this way for the internal rotation. Okay, and one last time. Okay, good. Now we're gonna keep him in flexion for D2, and we're gonna go into extension. So we're just doing the opposite way. The patient is in flexion of the hip, abduction, internal rotation at the hip, and dorsiflexion, toes in extension, and eversion. And we're just going to go the opposite way. So we do it toes down, foot in, and we're going to get from here. So push down, good. And we're going to do one more time, a couple more times. Toes down, foot in, leg down to extension and adduction. A couple more times. Toes down, foot in, hip down, good, and last time. Toes down, foot in, leg down, so hip extension, adduction, and external rotation. Okay. So here. Okay. And that is it for both D1, D2, flexion and extension of the lower extremities. That's it.